So being a nurse has its ups and downs. You see people at their worst when they're their sickest. And if you're lucky enough to see them towards the end of their hospitalizations, or in my case, after surgery, because the bulk of my career was in surgery and surgical services, you see them feeling so much better when they leave. I've had multiple experiences throughout my career with patients and families, and very positive experiences, but one that stands out to me. I had not been a nurse for very long, and I was working on the midnight shift, like most new RNs do. And I was taking care of a patient who was here in our community from Europe. He didn't speak much English. His wife was with him, stayed with him the entire time, and she didn't speak much English either. And he had a GI bleed. So we were caring for him and trying to, get an endoscopy and get him to surgery and all those types of things that you do for a GI bleed. And I had had him for a couple nights in a row, taking care of him, helping, trying to speak with them and trying to get them to understand. And by the third night, he was feeling better. The interventions we were doing were working, and he was able to, him and his wife, get out "thank you" to me. And I believe it was kind of like "thank you so much" in, broken language. But I said, "You're very welcome. That's what I do." And they handed me a little box. And I thought, oh, I wonder what this is. And, being from a different culture, I accepted the box and said thank you, and went out to the nurses' station. And I said, "You all, I just got a gift from the gentleman in, whatever room he was in." And they're like, "Oh," and so I opened it up, and it had this little gift in it, this little sword looking thing, and it actually is a little letter opener. And I said, "Wow, this is really," it's a little ornate and had bright colors and stuff on it. And I said, "Wow, this is amazing, how kind of them." And again, I was a new nurse, so I didn't know if patients, gave gifts often or what. Nursing supervisor came around then later, and I was talking to her about it. And she said, "Oh, Ruth, we're not supposed to accept gifts from patients." And I said, "Really?" And she's like, "Yeah." She's like, I understand. You're fairly new. You wouldn't know this." And I said, "Oh, but this is a patient from a different culture, from a different country, who spoke very little English. And I said to her, "You know what? I don't think it's appropriate to give it back." And we talked it over for a little while, and the nurses around the nurses station are chatting, and they're like, "Yes, you are absolutely right. Accept the gift, say thank you, continue to take care of him." I believe actually he was going home the next morning. But yeah, it was my first gift from a patient. Again, I still have it. 30, would it be 31 years later? I still have it as a nice memento of one of those great things, just a reminder of one of the great patients that I had, and helping him recover from his GI bleed.